anemias, sideroblastic anemias, and iron deficiency anemias, leukemias, storage disease, or even leishmaniasis, and even it also help in evaluation of non-hematological disorders metastasis. So bone marrow may be obtained by two different types, or by two different procedures. The first one is aspiration. Bone marrow aspiration is a simple, easy, and safe procedure, and as its name indicates, that this is aspirate from a place. So it's an aspiration of the marrow from the bones. So the first one is aspiration. Aspiration should be in liquid form, semi-liquid form. And the other one is trephine biopsy. So it's indicate in conditions where the aspiration either fails to yield marrow or to confirm some of the disease where biopsy findings are diagnostic. And if both of the procedures, like we have aspiration, we are taking aspirate from the marrow, and then we have trephine biopsy, that we are taking a part of the bone. And during aspiration, if the marrow is not obtained, it's called a dry tape. And dry tape is common, very common in hairy cell leukemia and myelofibrosis. It's because marrow has been replaced by fibrous tissue. So we have two types. One is aspirate and the other one is refined biopsy, where dry tape is that tape in which aspirates may not be obtained. That is called dry tape. So what is the basic difference between aspiration and trephine biopsy? So aspiration means the doctor or pathologist or hematologist sucks some liquid bone marrow up into syringe, and that syringes are or needles are special type of needles, like Salah or Islam or Jamshedi, where bone marrow trephine may means that they remove 1 or 2 centimeter core of bone marrow in one piece. You usually have both of these tests done at the same time, aspiration and bone marrow, both at the same time, because first they will take aspirate, then they will take a piece of bone that is 1 or 2 centimeter in size. They give some of the same information to the doctor, but there are differences. Aspirate means taking a liquid portion, sucks a liquid portion, while refined mean taking a piece of bone marrow. So these are the indication for bone marrow biopsy or bone marrow aspiration. Like why we need to aspirate or bone marrow biopsy. Uh, Generally, we are diagnosis anemia on the basis of CBC report. We are looking toward the CBC report, and we are focused on its indices and hemoglobin level. And whenever these levels are reduced, we know that which sort of anemia, that is microcytic or macrocytic anemia. Then we move forward and make a peripheral smear, and after looking at peripheral smear, we came to know that is there anisocytosis or peculocytosis or some enzymatic deficiencies. Then we move forward for chemistry, and and we done chemical or enzymes for that anemia. But sometimes it's unexplained anemia, and we should know the exact cause of anemia, or we are unsure for that. So we need biopsy or we need aspiration. So investigation of unexplained anemia, abnormal red cell indices, or cytopenias like pancytopenias, or cytosis like polycythemia. So in anemias, we can aspirate for megaloblastic anemia, aplastic anemia, sideroblastic anemia, and iron deficiency anemia, even anemia of chronic disorder, and investigation of abnormal peripheral blood smear that is suggestive of bone marrow pathology. We are looking for any pathology in the bone marrow. So if we have some abnormal peripheral smear, then we also think about the bone marrow aspiration or the bone marrow trephine biopsy. And the third one is diagnosis, staging, and follow of the malignant hematological disorder. And it's very important because staging of the leukemias, in leukemias, we have FAB classification or WHO classification. So on peripheral smear, we sometimes we are unable to diagnose is subleukemias or the exact type of that leukemia. Then we go forward for the aspiration, and we have much more amount for the flow cytometry or for the cytochemistry, for the enzymatic stains, and we know the FAB classification, like we have eight types: M0, M1, M2. So there are certain stages. So looking for that stage, we have bone marrow biopsy or bone marrow aspirate. So it's compulsory in some leukemias. So other than anemias and leukemias, we can also get bone marrow for the investigation of suspected bone marrow metastasis. And if there is some focal bony lesion or radiological imaging that is unexplained, then it's helpful for the bone marrow aspirate or a biopsy. And similarly, if we have organomegaly like splenomegaly or hepatomegaly that is unexplained, and we don't know the etiology, so the presence of mass lesions unavailable for biopsy, and that time it's also helpful for the diagnosis. Bone marrow aspiration and bone marrow biopsy is very important and or very helpful in the diagnosis of some anemias that is unexplained, and leukemias, we are finding the subleukemias or we are waiting the stage of leukemia. So bone marrow is also very important in the microbiological culture for pyrexia of unknown origin or specific infections like miliary tuberculosis or leishmaniasis, especially visceral leishmaniasis that is taken from the bone marrow, and malaria Plasmodium vivax, a parasite that cause malaria, and it accumulates in the bone marrow. So it's very important for the diagnosis of certain parasite by getting a bone marrow aspirate or biopsy. And like evaluation of iron stores, we need bone marrow, and investigation of lipid glycogen. Both are called storage disease. So it's very important for the diagnosis to have a bone marrow biopsy or bone marrow aspiration. It's very helpful in the diagnosis of unexplained or unknown causes or unknown etiology. That may be anemia, that might be leukemia, or that might be microbiological, or that may be parasites. So this is an important or a very helpful diagnostic tool in the field of hematopathology. So moving toward the bone marrow aspiration, now we have site of bone marrow aspirate, and up to here we conclude that bone marrow can be obtained by two different methods. The first method is known as bone marrow aspirate, and the other method is called bone marrow biopsy. And these are the two procedures in which one we take only a liquid form, and the other one we are taking a piece of marrow. And now from where we can obtain these aspirate or biopsy, so we can divide it into two phases. The first one is site for bone marrow aspirate, and usually sites for bone marrow aspirates are sternum, posterior superior iliac spine, iliac crest, anterior superior iliac spine, spinous process of lumbar vertebrae, and in infants, upper end of the tibia is the ideal site for marrow aspirates, where in the bone marrow biopsy, the sites for bone marrow biopsy, that is trephine biopsy, we can take from posterior superior iliac spine. This is most commonly used site for the trephine biopsy, and anterior superior iliac spine, and the spinous process of vertebrae.